Hello again and welcome to the continuation of our chapter 20 video lecture where we're talking about blood vessels and circulation. And we in this video will talk about section 2 on blood flow, blood pressure, and resistance. So there is an interrelationship that exists between pressure, flow, resistance, and being able to control the mechanisms that regulate blood pressure and blood flow. Within our flow, we can see that sometimes we will have a laminar flow where all of the fluid is moving in one direction, and other times in areas where maybe we have a little bit of constriction like we see in here, that could cause some turbulent flow in which that fluid is going to stop and sometimes move backward, kind of creating a swishing movement. So let's talk about measure of force exerted by our blood against the wall. As our blood is moving through the vessels, we are able to measure the blood pressure in there. And this is measured by listening for Korsakoff sounds. And that is due to that turbulent flow that we just saw in the image before, in the previous slide, in our arteries as that pressure is released from the blood pressure cuff. So if you look at this image over here, we can see the systolic pressure at the very top. This is going to be the higher value when we are stating blood pressure, and typically for normal blood pressure we want it to be around 120 millimeters mercury. And what this represents is when that arterial pressure is being ejected from the heart during ventricular contraction, or what we know as systole. Whereas the diastolic pressure is our lower value. So typically we want this to be around 80 millimeters mercury and is going to be represented by the arterial pressure of the blood when the ventricles of the heart are relaxing. So of course this isn't going to go down to 0 because we're still having pressure that exists pushing that blood flow through the vessels. So you can see as the blood is leaving the heart, this is the aorta, right? And we're moving through the systemic circulation, we are starting to see that blood pressure drop as we get to the arterioles and then to the capillaries. And by the time we get to the venules and the veins, it is much lower. And by the time we are back at the heart through the superior and inferior vena cava, we are at 0. Now let's talk about what pulse pressure is. This is when we take the number, our systolic blood pressure, so let's say it's 110, and our diastolic blood pressure, which is 68, and subtract them. And so this number, 42, would be our example of a pulse pressure. It tends to increase when stroke volume increases. Remember, stroke volume is the amount of blood that is exiting the heart per minute, and the vascular compliance is going to decrease. Then we have our compliance that tends to decrease with our age due to things like atherosclerosis, where we have the buildup of that plaque in the wall and our vessels are not able to contain as much blood within them, and that will cause the pressure to rise. Pulse pressure can also be used to take a pulse to determine heart rate and our rhythmicity. And the most frequent sites to measure the pulse rate is used in our carpus, aka the wrist, with our radial artery. And this is known as our radial pulse. The other most frequent place to use is our common carotid artery within the neck. When we say pulse, we're talking about the throbbing of these arteries due to difference in pulse pressures, which can be felt under the skin. So there's all these different pulse points in which the arteries lay closer to the skin, so we are able to palpate that and count the beats and also feel for the pulse. Now let's talk about how we measure blood pressure. You all probably have done this before, but let's go through it. We're going to put a cuff on the arm with the dial on the brachial artery. What we want to do is inflate this cuff so the pressure is high enough to keep the brachial artery closed, and that's what we're seeing at the very top here. So no blood should be flowing through and we can't hear any sounds with our stethoscope. So when our cuff pressure then will decrease and we're not able to keep our brachial artery closed anymore, we can see in systole, that is when the first sound is heard. So at that point, that is what we would record as our systolic blood pressure. Then we hear that those sounds, the heartbeats going do 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 do, until when we have diastole and the artery is open, then we are going to have the sound disappear, and that is when we look at our dial and we are going to read off the diastolic pressure, and we now have our blood pressure levels. You can completely uninflate. Does that sound right? Deflate is the word I'm looking for, to open up the artery and allow all the blood to flow through. And here's a great figure that depicts for us the pressure that is taking place in our blood vessels. So you can see diastolic, systolic, right? So when we hear that first sound, we can see that it is in relation to that systolic pressure. And then as we open up the artery during the heart relaxation, we hear the last sound before we hear no sound anymore, and that is going to be our diastolic pressure. Next, let's talk about the variables that affect blood flow and blood pressure. So we've got 5 variables that do this for us. We've got cardiac output, compliance, which we've talked about before, our volume of blood, the viscosity of blood, and blood vessel length and diameter. So let's talk about each one of these individually, starting with cardiac output. When we use that term, we're talking about the amount of blood flow from the heart through the ventricles, and it's typically going to be measured by liters per minute. And so this is calculated by taking our heart rate, which could be affected by nerves and our hormones, and multiplying it with stroke volume, which is affected by blood volume and our vascular resistance. And so anytime we have heart rate or stroke volume increase, cardiac output will also increase, and vice versa. If these decrease, cardiac output decreases as well. Next, let's talk about compliance. Compliance, again, is going to be when we're able to kind of stretch out the vessel in order to accommodate more blood volume within it. So greater compliance of an artery means that we more effectively are able to expand and accommodate surges in blood flow. You could see that increased pressure here, in which we are stretching and allowing it to balloon out and containing more fluid as a result. When we have vascular disease take place, we have reduced compliance and we have stiffening within the walls, and therefore we're not able to stretch as much. So we get resistance to blood flow is increased, and the blood flow becomes more turbulent, and we get higher pressures and reduced blood flow. So there's an interesting relationship between blood volume and pressure. When our blood volume decreases, the pressure and the flow will also decrease, and vice versa is true. If someone is suffering from hypovolemia, that means they have low blood volume. This could be due to bleeding, dehydration, vomiting, severe burns, or sometimes medications that are used to treat hypertension can do this. So the treatment is typically going to be rehydrating them, right? So in doing that, we can give intravenous fluid replacement. Then we have hypervolemia. This is when we have excessive fluid volume, and this could be due to retention of water and sodium, which we see in a lot of heart failure patients, people with liver cirrhosis, some kidney diseases, hyperaldosteronism, which if you remember what aldosterone does, it's going to reabsorb sodium and water, so again containing extra fluid within our body, and some glucocorticoid steroid treatments. And so to treat this, we have to figure out what the underlying cause is and treat that condition. For blood viscosity, we are talking about the resistance within that fluid. So we know that blood is going to be more viscous than water, so it has an increased thickness and a stickiness within it. So the resistance has to be proportionate to the flow. As the viscosity increases, the pressure required to get that blood to flow needs to increase as well. Viscosity is influenced mostly by our hematocrit, that percentage of our total blood volume composed of our red blood cells. And we've talked about this too in blood doping, how when we have more red blood cells, that's going to increase the viscosity of our blood. And so when we become dehydrated, we have less fluid than we do our solutes, our red blood cells. And so that could lead to increased viscosity, which increases the workload on the heart to create pressure in order to get that blood to flow to the proper destination. And lastly, we are going to talk about the vessel length and diameter in relation to blood flow and pressure. The total blood vessel length determines the amount of resistance. So the longer the vessel, the greater resistance that we see. And if we have a larger blood vessel diameter, we will see that resistance will decrease and vice versa. So as you can imagine, an elastic artery like the aorta versus something like a capillary that is really small, we do have more resistance as it becomes smaller. And we could see this here in the velocity of the blood flow as well. Now for our clinical application on arteriosclerosis. Arteriosclerosis, notice it's not atherosclerosis, is a general term for degeneration changes in our arteries that makes them less elastic. So this could be due to high blood sugar, infection, tobacco use, excessive blood lipids, or other factors. And so one of the types of arteriosclerosis is atherosclerosis, where we get a accumulation of this plaque within the walls of the vessels. And you could see that taking place here in this histology image too, where this is going to be the lumen and this is more toward the external surface of the blood vessel. And the last thing we'll cover in this video is on the venous system. Our veins rely on our skeletal muscles to help pump that blood back to the heart. So in our standing position, our hydrostatic pressure caused by gravity increases the blood pressure below the heart and will decrease pressure above the heart. So our skeletal muscles that we find surrounding our veins are going to be able to contract, which push on our veins and allow a one-way flow. And of course, those valves open up to allow the blood to move in. And if it tries moving backward, the valve catches it to ensure it moves in one direction. To continue this up into the thorax, we use a respiratory pump. This is aiding our blood flow through the veins of our thorax as well as the abdomen. So when we inhale, we are inflating those lungs and blood is flowing along its pressure gradient from the veins outside of the thorax, where that pressure is higher, into the thoracic region where the pressure is lower. This in turn is promoting the return of the blood to those thoracic veins into the right atrium. Now during exhalation, which we see here, push all that air out, is when the air pressure increases within our thoracic cavity and the pressure in the thoracic veins now increase. That speeds the blood flow into the heart while our valves in the veins are preventing it from moving backward from the thoracic and abdominal veins.